طيب تمام. السلام عليكم. يعطيكم العافية جميعا. My name is Asma Kremli. I am an R2 resident in King Khalid University Hospital. First, I would like طبعا to thank the Radiology Interest Group in King Saud University for this opportunity. And I'm glad to be in the first Radiology Interpretation Workshop session. Today, we will talk about Introduction to Medical Imaging Modalities. Our objectives from this session, we will talk about a brief background on the technology behind each modality and a little bit of physics with the advantages and disadvantages of each modality with the comparison in the end, inshallah. So the imaging modalities that I will talk about today will be the X-ray or radiograph and ultrasound, and then the computed tomography or CT. So starting with the X-ray, the X-rays is two-dimensional images, and it uses ionizing electromagnetic radiation. So what do we mean with ionizing electromagnetic radiation? The ionizing radiation is the term given to forms of radiation that are energetic enough to displace orbiting electron from the atoms in the absorbing medium. Thus, it will form a positive ion. This is how we can acquire an X-ray image. Talking about the X-ray advantages, X-ray or radiographs have a lot of advantages. For example, cost. X-rays are less expensive than CT scans and MRIs. Also, it is widely available and faster to use. It uses low radiation dose or low exposure to radiation. Because it uses low levels of ionizing radiation. So it's considered somewhat safe. And then we have the advantages. It has good contrast between bone, soft tissue, lung, and air. For example, this diagram here, we can see a chest radiograph. It will show the image from white to black colors. White or radio opaque being the bone, and gray, either light or dark gray, will be the soft tissue, and the black or radiolucent representing air. Also, one of the advantages of X-ray that it has real-time imaging. So that will allow the doctors to see movements and used in fluoroscopy, either fluoroscopy imaging or even inside the operation rooms. We can use fluoroscopy utilizing X-rays. And one of the advantages as well is the portability. So X-rays can be formed at bedsides or clinics, that making a convenient option for patients who are unable to move. These are mainly the advantages of radiographs. What about the disadvantages? Of course, as we said, that it has good soft tissue details, but still it is limited. I would like you all to pay attention to this radiograph, because in the end of the lecture, I will show you the same patient with the same position, but in CT scan. X-rays do not provide detailed images of soft tissues. So in some conditions, it may not be the best option to diagnose some conditions. The second disadvantage is limited views, and as well as being two-dimensional. X-rays typically only produce images from one or two angles, making it difficult to fully evaluate complex conditions or structures. The third disadvantage is the radiation exposure. As though as it uses low exposure, but still X-rays use ionizing radiation, which can increase the risk of cancer with repeated exposure. This may be a concern for some patients, especially pregnant women. These are mainly the X-ray modality. Moving to ultrasound, of course, this is the ultrasound machine that we use. And the ultrasound, basically, it uses high frequency sound waves, starting from 2 until 18 megahertz. And the range of audible frequencies for a human, as seen in the diagram here, is from 20 hertz to 20 kilohertz. But as we said, we use from 2 to 18 megahertz. How does it work? A sound wave is transmitted through liquids as a longitudinal wave, in which the movements of particles in a medium are parallel to the direction of propagation of the sound wave. So sound wave transmits their energy mechanically through pressure variations on the particles. This is how we can obtain an ultrasound image. What about the ultrasound advantages? So ultrasound, it is non-ionizing sound waves, so it's not associated with carcinogenesis. This is important in evaluating fetus and gonads, especially. The second advantage is the availability. In most centers, ultrasound is more readily available than more advanced cross-sectional modalities. The third advantage will be cost. Ultrasounds are less expensive than CT scans and MRI scans. The fourth advantage is portability. Just like the X-rays, we can use portable ultrasound devices, and that will be also more convenient in patients who cannot move, and it can be used bedside or in clinics as well. The fifth advantage will be there is almost no contraindications compared with contrast-enhanced CT or MRI scans. And the sixth advantage that it has real-time imaging. Real-time nature is useful in evaluating physiology as well as anatomy. So what are the ultrasound disadvantages? First of all, training is required to accurately and efficiently conduct an ultrasound exam. And there is non-uniformity in the quality of examinations. So it is operator dependence. Second disadvantage, that the ultrasound is not capable to evaluate tissue types with high acoustical impedance. For example, bone and air. It is also limited in evaluating structures encased in bone, for example, brain parenchyma. So that's why we use ultrasound of the head in pediatric patients, because the anterior fontanelle is still open, so we can actually do ultrasound images of the brain. But as the human grow up, that fontanelle will close, so we will not be able to evaluate brain parenchyma using ultrasound. And then the third disadvantage is thermal heating or mechanical injury, because high frequencies of ultrasound result in a potential risk of thermal heating or mechanical injury to tissue at a microscopic level. This is of most concern in fetal imaging. And then the fourth disadvantage of ultrasound is the artifacts. Ultrasound has its own set of unique artifacts which can potentially degrade image quality or lead to misinterpretation. But there are some useful artifacts, like this one shown in the image. This is a gallbladder with gallstones. And there is an artifact called posterior acoustic shadowing that we can see behind or posterior to the stone. It is here. There is shadowing. So this indicates that this is a gallstone, not, for example, a polyp. Okay, and now we will take 2 to 4 minutes break. For example, زي هذه الإيمج اللي shown here, the posterior side of the gallbladder, it should all be enhanced like this. I don't know if إذا كان الماوس أو الكرسر واضح. فإحنا المفروض gallbladder because it's filled with bile, which is fluid. So posteriorly, it will enhancement. Enhancement means this white or light gray color. When we have a stone or calcification, it will cause shadow. So this is one example of artifact. Artifact is something that it's not desirable or we don't want to be shown in the ultrasound. ممكن يعني انه نبسطها بطريقه ابسط، انه مثلا زي الاكس رايز اذا كان في مثلا اوفر اكسبوجر او اندر اكسبوجر، كيف تصير الايمج اذا كلها وايت او كلها بلاك. فهذه اشياء ما يرغب فيها الواحد لما يشوف الصور، لكن احيانا some artifacts في الالتراساوند تكون يوسفل عشان نعرف انه هذه ستون ما هي بوليب، لان البوليب has very similar appearance but without the posterior shadowing, which is the dark or black shadow posterior للstone.
تمام، واضح دكتورة.
Okay, now we will move to the CT scans or computed tomography. So CT scans uses X-ray to build cross-sectional images or slices of the body. CT is based on the fundamental principle that the density of the tissue passed by the X-ray beam can be measured from the calculation of the attenuation coefficient, something called attenuation coefficient. We use calculation of the X-ray beams, and this is how we obtain CT scans. So using this principle, CT allows the reconstruction of the density of the body by a two-dimensional section perpendicular to the axis of the acquisition system. So we will form a 3D image from different X-ray machines that works simultaneously together. And this is the CT machine that we see in hospitals. And the picture in the right, it shows the CT from inside. There is a principle that's very important. Before the data are presented on the screen, the conventional rescaling was made into CT numbers. These CT numbers expressed in dimensionless Hounsfield units. anyone will be in a CT reading room, they will hear a lot of this Hounsfield units. So what do we mean with Hounsfield units? So Hounsfield chose a scale that reflects the 4 basic X-ray densities in the human body with the following values. Air is minus 1000 Hounsfield unit, fat is minus 60 to minus 120 Hounsfield unit, and water is being 0 Hounsfield unit, and then the compact bone is 1000 Hounsfield units. So what do we mean about this? Here in this CT of the brain, if we measured the Hounsfield unit here at this area, it will, I'm not sure, the cursor is not visualized. خلينا نشوف. Okay. So in this area, which is the air, if we calculated the Hounsfield unit, here it will be minus 1000 Hounsfield unit. And then the fat will be from minus 60 to minus 120. After that, the water, which is CSF fluid, that will be 0. And the bone will be positive 1000 Hounsfield units. So the bone will be white, and CSF or water will be dark gray, and air will be black. Anything between the water and bone, it will shown with different shades of gray, either light gray until we reach to dark gray. After that, we have different planes in CT. We have the axial, coronal, and sagittal acquisitions or planes, as shown in this diagram. The axial plane shows in green, which is this image here. The axial plane or slices, here we can see the posterior part of the body, anterior part, lateral on each side, and the medial, all in the same image, but it will be only at one cut. For example, if we put this one here, it will only show this area. And then the sagittal plane, which is the blue one, it will show the anterior and posterior, and the one cut will only show either lateral or midline or medial, and so on. And it will, in addition, it will show the superior and inferior parts. And then we have the coronal plane, which is the pink one, as shown in this image. The coronal will allow us to see the superior, inferior, both lateral sides or both sides, and the midline structures. But anterior and posterior will be in each slice. So in general, when we read or interpret CT scans, we have to see all the 3 acquisitions or 3 planes in order to localize and characterize a certain lesion or structure. Moving on to the CT advantages. So the advantages of CT scans, that they are 3-dimensional images, as we saw previously. We can exactly localize and we can exactly localize the mass or structure or whatever we wanted to localize. And the second advantage, it has detailed soft tissues, and most systems can be scanned, not as we said in ultrasound. So we can scan in CT scans, we can scan the brain from brain to feet. And the CT is faster than MRI, but of course it will take longer time than X-rays, but it will take only a few minutes also. How about the disadvantages? The CT usually requires breath holding, which some patients cannot manage. And again, there are CT artifacts that are different than ultrasound artifacts, but it has the same principle that the artifact is something that we do not want in the image. Some examples of CT artifacts are beam hardening artifact. And beam hardening artifact is when there are two dense structures beside each other, and we will see like lines between them. I didn't provide an image, but I can show you in a bit. And this called, as I said, beam hardening artifact. And other artifact that is very common is motion artifact when the patient moves during the scan. So we will see the movement in CT, and that's undesirable. And then the third disadvantage is that CT scans uses high doses of radiation. For example, one chest CT equals to 350 chest X-rays. And in this diagram, here we can see that the chest X-ray, it will give a dose of 0.02 millisieverts, which is the effective dose that will be absorbed by the body when using a chest radiograph or chest X-ray. And here we can see that the CT for pelvis, for example, or abdomen, it will equal to 10 millisieverts. So we can see there is a huge difference between X-rays and CT scans in form of doses of radiation. And the fourth disadvantage of CT scan, that there are contrast complications when used. For example, some patients may have contrast allergy. Some patients may have contrast extravasation. And in some conditions, the contrast may cause renal failure in some patients. And now I will talk about comparison between each of the three modalities that I talked about. As we said, X-ray is two-dimensional. Ultrasound, there are two-dimensional ultrasounds and three-dimensional ultrasounds that are used in obstetrics mainly. And the CT is three-dimensional. The X-rays use low radiation dose, while ultrasound, there is no ionizing radiation. And the CT, there are higher radiation dose. The X-rays have limited soft tissue details. Ultrasound, there is good soft tissue details except for bone and air, as I mentioned. And CT scans, it shows good soft tissue details. Again, for the X-rays, it is available and it can be portable, as well as the ultrasound, the same, available and portable. Whereas CT scans have limited availability and no portability. So remember this image I showed you in the beginning. This is an abdomen radiograph of a patient. We can see that there is dilated bowel loops, and it shows bowel obstruction. But we can't see, or it's difficult to see any further information. When we did CT scan for the same patient, we can see that there is severe ascites, and if we scroll down and up and anterior posterior, we can see exactly where is the obstructed bowel, and we can give location of the obstruction. And these are my references. and thank you for listening. Do you have any questions? I'd be more than happy to answer.
في بعض الأسئلة بعد ذلك.
صح.
دكتورة، بالنسبة للكرونيك يوز اوف كونتراست، هل في خطورة على ال CT scans الكرونيك repetitive use of contrast material؟
طبعا, as I said, yes, there might be some patients might develop renal failure, but in some conditions. That's why when we do CT scans with contrast, we should have renal function test and GFR for the patients prior giving them the contrast.
اوكي جميل. ودكتورة، ايش بعض الانديكيشنز حقت اليوز اوف كونتراست؟ هل في قاعدة واضحة يعني ولا it is case specific؟
Usually in most cases we use contrast. Exceptions are the cases, for example, if we want to see kidney stones, and if the patient is already known to have chronic or acute kidney injury, but it will not show good parenchyma without contrast. So usually the contrast is used very, very widely.
تمام واضح دكتورة. دكتورة، في سؤال بخصوص يعني في الورك لود او الورك سيكونس حق الراديولوجيست، يعني هل لما يطلبون سي تي سكان they specify certain view coronal or axial، او هل والله موجود في الباكس كل الفيوز هذه موجوده already؟
Usually, not usually, all the times, yes, we use all the three acquisitions. It will not elongate the scanning time. It will be computerized doing the three acquisitions. So every patient will have the same time during scanning, and then the technician or technologist, he or she will do the acquisitions and send us the pictures in the three formats, which are coronal, sagittal, and axial. So each study will have the three planes.
جميل دكتورة، واضح، يعطيك العافية، شكرا لك.
الله يعافيك.